In this video of D4 therapy, we will learn about persistent depressive disorder or PDD in 5 minutes or less. We will go over the diagnostic criteria A to H and the changes that has been made in the new DSM-5-TR. So, looking at the symptom criteria A states that there has to be depressed mood or irritability. So, depressed mood in adults or irritability in kids. Criteria B says that the person has to suffer from poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue. They probably have low self esteem and have difficulty concentrating or indecisive and have feelings of hopelessness. You have to have two or more of B and have to have A. So if you have gone over the criteria for major depressive disorder, the difference here is that the symptom criteria are divided into A and B, whereas in depression, the symptom criteria are all in the criteria A, and you have to have five of the nine. So, looking at the duration criteria, the criteria C says that an adult probably would have shown symptoms for about 2 years, and a kid would have shown the symptoms for about 1 year. And there is no time for more than 2 months where the symptoms of persistent depressive disorder have not met. If the person has major depressive disorder, then this has continued for about 2 years. Going to the exclusion criteria, that is that the person has never had a manic or a hypomanic episode, which makes it to then cyclothymia. This is not because of another mental health disorder like schizophrenia. This is not because of use of substance or medication. And an intensity criteria is that it causes clinically significant distress. So that is all the criteria A to H. Now let's look at what are the changes that has been made in the new DSM-5-TR. So in the DSM-5, dysthymia used to appear in parentheses with persistent depressive disorder. So now the parenthesis has been removed, and that is because that dysthymia in DSM-4, that is the one that was before DSM-5, had imposed levels of severity for depression. So if the word was dysthymia meant that the symptoms are not as severe, and it required that major depressive disorder criteria have not been met. Hence, dysthymia can be confusing when it appears in parentheses because the word generally means less severe than major depressive disorder, which we now know is not true for PDD. Hence, after the transition phase, the word from the parenthesis has been removed. Some other changes is that there are multiple specifiers that used to be present. There are seven specifiers in PDD, the previous DSM, and now they have removed most of the specifiers except one with anxious distress and two with atypical features, because these are the only two specifiers that explicitly are applicable for persistent depressive disorder. If you found this video to be helpful, please consider subscribing and liking.